Can I come in? Good morning. How are you? I'm Miranda. It's me. I'm back again. I'm get some hand sanitizer on and put on my gloves. You care to tell me your name and date of birth again? All right, Mr. Smith. Do you have any allergies? No allergies? Okay. All right. So I have an order to give you a heparin injection, and it's what we call a subcutaneous injection, just meaning that it's going to go in the fatty tissue on your body somewhere. I have my students here with me again. Do you mind if they come in and I kind of walk them through this as I'm doing it? No. Perfect. I appreciate that. All right. So wash my hands. I've put on my gloves. I've ID'd Mr. Smith. I'm going to go ahead and do my medication checks. So just like with all your medications, you're going to do your 3 checks. So I checked the medication when I drawed it, when I retrieved it out of our Pyxis system. I made sure that I had the correct medication. So I have heparin, and it's 1 ml, 5,000 units. And then I take that outside the patient's room. I'm going to double check one more time, that second check, to make sure I have the correct medication. And then I'm going to do my 3rd check at the bedside before I give the medication here to Mr. Smith. I'm also going to do my rights of medication. So remember, we're going to check that we have the right patient, that we have the right medication, that we have the right dose, the right route, the right time, and the right documentation. Just meaning that we're going to document after we do this, Mr. Smith. Okay, so we're going to go ahead and just talk about needles. So for a subcutaneous injection, or sometimes referred to as a subcu injection, we are actually injecting the medication into the adipose tissue of our patient. And generally medications that we are going to use a subcutaneous injection for is going to be like a subcu injection. So insulin, heparin can be given subcu, Lovenox or enoxaparin. And so there are several different insulin and non-insulin medications that we can give. So as far as needle size for insulin, typically we're going to do a 0.3 to 1 ml syringe. And so I have a couple of different things here. So I do have an insulin syringe. So my insulin syringes come in a little bag. So you can see I have a 31 gauge. It's 5/16 inch, and these are 30 units. I have a 1 ml, 25 gauge, 5/8. And then I have another 25 gauge, 5/8, but this one's a 3 ml. So generally, you're not going to use more than a 1 ml syringe. Now, you can use the 3 ml to draw up 1 ml if necessary, right? So typically, when we're looking at insulin, our needle length is usually between 3/16 and 1 inch, just depending on our patient. So our insulin syringes here are 5/16 of an inch. For non-insulin volumes, again, generally upwards to 1 ml. Our needle length is going to be 25 to 27 gauge, and generally either between a 3/8 to a 5/8 inch needle. So a lot of times for heparin, when we're giving heparin or other non-insulin medications, we may use what we refer to as a TB syringe or tuberculosis syringe. And that's those syringes that are gray. And that's just because these are very small needle. So you can see this is a 27 gauge, 1/2 inch. And it allows us just to very easily draw up small amounts of medications. So this is labeled by 0.1, 0.2, all the way to 1 ml. And so we can do a very small dose. Opposed to if we have something like this 3 ml, you can see we can't do as minute dosages with this. Okay, so I'm going to use my TB syringe because it is generally the best option for a patient who is going to get a heparin. So I'm going to go ahead and just pop my cap of my heparin, and I always like to just scrub it. And then remember, whenever you're drawing up, you need to draw up the amount of air that you're giving. So I'm going to go ahead and draw up 1 ml. And with your TB syringe, remember, you're going to have a large part of your plunger out because we're giving the whole dose of the syringe. So I'm going to pull it down to 1, remove my cap. I'm going to inject the air. And then remember, you're going to invert the syringe. And then I'm just going to be cautious not to touch my needle. And I'm going to pull up. You want to do it kind of slow so you don't get a bunch of air in there. So we're going to draw this up. Doing okay, Mr. Smith? He's heard me talk so much today. He's sick of it, aren't you? All right, and so you can see I've got my 1 ml. So that's my 5,000 units of heparin. And remember, if you're going to put the cap back on, you can only do that for a needle that hasn't been used on a patient. So I am going to go ahead and do the scoop technique so that I can protect this needle while I'm getting Mr. Smith ready. All right, Mr. Smith. I'm going to give this in your belly if that's okay. All right. You're okay with them watching? Perfect. All right. I'll keep you covered. I'm going to lay you flat a little bit so that I can get to your belly a little better. So Mr. Smith has done this a few times, so he knows the drill. But I'm just going to explain to the patient that I'm going to pinch some skin, some fatty tissue, and that's where the medication is going to go. And it really isn't a big, painful injection. So they shouldn't have a lot of pain during this. There are several different places that you can do or administer a subcutaneous injection. So the outer aspects of the arm, so kind of the back part where that fatty tissue is, we can do the belly, we can do the thighs or the butt kind of near the waistband. So there are lots of sites. We just want to make sure that we have an adequate amount of subcutaneous tissue. For heparin, though, the abdomen is the only site that is recommended for patient safety, okay? So I'm going to go ahead and I'm going to clean. I don't want to go too close to his belly button, so I'm going to do about 1 inch from his belly button. So you guys can come a little closer if you want so you can see better. So you can see his little belly button there. Yes, Mr. Smith. All right. So I'm going to go ahead and I'm going to clean. And so when you're doing heparin particularly, you want to be sure to rotate sites. So if I'm giving Mr. Smith heparin, every day, I don't want to give it in the same exact spot. I want to kind of work my way around. So this is another reason why it's really important to make sure that you're documenting the site of the injection. Okay. So I'm going to do it. I'm going to start right here at kind of this right side, about 1 inch from his belly button. And remember that when you're cleaning, if you're using alcohol, that you need to clean in a circular motion. If you're using CHG or ChloraPrep, then that has to be done in a back and forth motion. Please be sure that you know the policy where you work at and what is required. And again, we need to make sure that we let this dry. That drying is really the part that kills all those germs and bacteria. All right, so again, with my non-dominant hand, about 1 inch from the belly button, I am going to pinch some fatty tissue there. And if your patient is obese and the pinch of adipose tissue is 2 inches or more, then we might need the longer needle. So for Mr. Smith, his pinch is less than 1 inch. So I'm going to insert this at a 45-degree angle. So I cleaned there. I've got my bevel up and I'm pinching less than 1 inch and I'm injecting at about a 45-degree angle. And then I'm going to just inject slowly. And then carefully removing the needle, engaging the safety, and then I'm going to go ahead and just kind of blot if there's any blood or anything at that area. I'm going to kind of blot that. I'm going to make sure I put my safety cap engaged needle into the sharps. And then I'm just going to make sure that I document. I'm going to get Mr. Smith back in a nice comfortable position, get his bed down, make sure I get him anything he needs. And then I'm just going to keep monitoring that site to make sure he doesn't have any kind of reaction. All right, Mr. Smith, can I get you anything? All right.